Hey everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, May 17th. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now, for those of you who closely follow either government or politics or developments here on Beacon Hill, you know that every year, traditionally, April through July are really the busy time in terms of legislative activity. And 2024 is really proving to be no different. If anything, it's unusually busy. In addition to the issues that we are directly focused on, whether it be the establishment of the Special Commission on the COLA, the increase in the state's basic life insurance benefit, the veterans bonus legislation that we are currently engaged in trying to improve, there is a lot going on in terms of the things that directly impact public retirees. But beyond that, we are also closely following other legislation that could potentially impact retirees as well. And legislation that just passed the House of Representatives yesterday is a clear example of that type of legislation. If you've been following the news at all, you know that over the last several months, a crisis has come to be through Steward healthcare system. Steward, of course, is a hospital chain. They are headquartered now in Dallas, Texas. They own and operate 9 hospitals here in Massachusetts. The majority of those hospitals were once the Catholic hospitals that were acquired by Steward back in 2010. And now, 14 years later, Stuart has recently declared bankruptcy. There has been a plethora of information reported in the press about the various details of what's happened and the different allegations pending against Steward, and that is more than I can possibly address in this video. But what I want to focus on is what the state is doing in response. Now, obviously, 9 hospitals that have their parent company having declared bankruptcy and the uncertainty that comes with that is a source of great concern for all of us. And in particular, we're concerned for those members who are seeking ongoing care or receiving ongoing care at any of the 9 hospitals. The last thing anybody needs is to have the turmoil of either not being able to get that care in a community setting, and all of the lack of peace of mind, so to speak, that goes with that. So just yesterday, on Thursday, the House of Representatives took up a pretty large hospital reform bill. And this legislation is in direct response to the Steward crisis. House Speaker Ron Mariano has been directly involved in crafting this legislation, along with Chairman John Lawn, who is the chair of the Joint Committee on Healthcare Finance. His Senate counterpart is State Senator Cindy Friedman from Arlington, and Representative Lawn comes from the town of Watertown. And you might recognize Representative Lawn's name as the lead sponsor of our legislation increasing the basic life insurance benefit that just recently passed the House of Representatives. So Representative Lawn, just like Senator Friedman, are close allies of our association. We frequently work directly with them and their staff on a variety of bills. So our healthcare system is really in good hands with both of them chairing this particular committee. The House took up the legislation, as I said, yesterday. There are a number of parts of the bill, and again, I'm not going to get into the details here. If you're watching this video and you receive today's email message from Mass Retirees, and hopefully if you are a member, you are receiving our emails, but contained within the email is a link to an op-ed piece, an opinion editorial that occurred or appeared in the Boston Globe on Wednesday that was published by or written by Speaker Mariano and Chairman Lawn, explaining what's behind this legislation, explaining what they are trying to tackle, and most importantly, laying out the steps being taken by the Commonwealth, not only to protect the 9 hospitals that are currently owned by Steward, but also to take steps to make sure that this type of thing can never happen again. Because it not only creates a lot of turmoil, it also creates a problem for our overall healthcare system, which is not good for anyone, in particular a state like Massachusetts, which is world renowned for the quality of our healthcare system, and we don't need these kind of problems. So that legislation passed the House yesterday. And in terms of Steward, I just want to take a step back and acknowledge that when Steward first bought or acquired the Catholic hospitals back in 2010, and it became public that their parent company at the time, the company was sold in 2020, but Cerberus, which is a private equity firm out of New York City, Steward operates as a for-profit system. It was very controversial back in 2010 and has continued to be controversial in some aspects ever since. One of the points of controversy is the fact that Steward is a for-profit company owned by a private equity firm whose goal naturally is to make money, which in and of itself may not be a bad thing, but in the context of healthcare, particularly in a state like Massachusetts, that has long prided itself in the fact that the majority, if not all, of our healthcare entities here in Massachusetts have traditionally or historically been not-for-profit entities, it raised some eyebrows back in 2010. And as a matter of fact, our association were amongst the groups who were concerned about this. And back in 2010, our former president and co-founder Ralph White penned several articles expressing our deep concern about where this could be heading down the road. Ralph just had a gut feeling that just didn't leave him comfortable with, and like many things when it came to Ralph, his gut feeling tended to be right. And unfortunately, here we are again 14 years later with the current crisis that has to be tackled. Now, we're confident that both the Healy administration, in terms of the day-to-day activities that are going on and focus to make sure that these hospitals are going to continue to operate successfully and that their patient bases and the communities that they serve will continue to be well served by the excellent staff who are working in these hospitals, but also over the long haul of changing the laws here in Massachusetts to make sure, to the best of our ability, that these types of problems cannot ever happen again. Now, the legislation is going to the state Senate. We anticipate it will most likely be brought up in the coming weeks. The Senate has also been working on reform legislation focused on prescription drug benefits and specifically pharmacy benefit managers, the so-called PBMs, which have been receiving a lot of national attention, much of it critical, over the role that PBMs allegedly are playing in the continued increase in pharmaceutical costs. As a matter of fact, NPR's Marketplace just did a story on this very topic just a few days ago. The link to that Marketplace report is also contained within today's email report to all of you. So please look for both of those links, both on Steward as well as on the Marketplace link, to give you a little bit further of background explanation of the ins and outs of these issues. Now, also in terms of health insurance and healthcare in general, just yesterday, the state's 17-member Group Insurance Commission held their monthly meeting. It was the first meeting since the rate-setting meeting back in March. This particular GIC meeting, amongst other items on the agenda, also contained a report on out-of-pocket costs, so-called OOP costs, out-of-pocket costs. Now, what out-of-pocket costs are the copayment and the deductibles that we all pay. That's what are referred to as out-of-pocket costs. Our monthly insurance premiums are separate from that. So in terms of out-of-pocket costs, the majority of out-of-pocket costs charged by the GIC are focused on the non-Medicare plans. For instance, the non-Medicare plans have a $500 per person annual deductible set to a maximum annual deductible of $1,000 per family. That only applies to the non-Medicare plans. For retirees who are insured under Medicare, there is no annual deductible. So it's a significant difference, and that's one of the reasons why we are so focused on the Medicare buy-in program and continue to work with the GIC and encourage the GIC to implement that program as soon as possible. And we will continue to update those of you who are non-Medicare eligible retirees who are insured under the GIC We'll update you as new information is available, but this is an issue that's at the very top of our priority list to get some type of resolution moving before the end of 2024. But the out-of-pocket report, which is something that's done periodically by the GIC, this year's report looked back over the past 5 years. So it went from 2019 through 2023 and looked at the growth in other demographic information in terms out of the out-of-pocket costs. Now the good news is, and those of you who are insured under the GIC, I think are hopefully aware of this by now, out-of-pocket costs under the GIC have been very stable for the past 6 or 7 years. There has been no across-the-board increase in either copayments or deductibles over that period of time. And the report that was presented yesterday certainly speaks to that. Over the past 5 years, the average monthly increase, dollar increase in out-of-pocket costs are on average $3 per member per month. Now, again, because of the fact that the deductible only applies to non-Medicare retirees, the lion's share of those cost increases in terms of out-of-pocket costs have been applied to our non-Medicare retirees and active employees, which again makes it all that much more important that we work with the GIC to implement the Medicare buy-in program, which, if we're successful, will reduce out-of-pocket costs on retirees who are not currently enrolled in Medicare. Now, the reason or what's driving that $3 increase over the past 5 years isn't the deductible side, isn't the copayment side of things. Again, copayments have stayed the same. If you get a prescription drug, if you get a generic, it's a set dollar amount. The preferred amount is a set dollar amount. The highest tier of the 3 tiers is a set dollar amount. Same with going for a doctor's visit or having tests done. There's a set dollar amount that's applied across the board. On the deductible side, it's different. The $500 annual deductible under your healthcare plan, again, if you're in a non-Medicare plan, that deductible works the same way that your deductible on your automobile insurance or your homeowner's insurance or renter's insurance would work, where you are responsible for the first $500 of your healthcare costs. So if you go for a test, you go for a doctor's appointment, you go in for surgery, the first $500 over the fiscal year, because again, the fiscal year starts on July 1st, that first $500 you would be responsible for. And what we have seen over the past 5 years is a significant increase, once again, in healthcare inflation, the amount of money being charged for healthcare procedures. That has certainly gone up over the past 5 years, and that is reflective in the fact that retirees and active employees are paying a little bit more per member per month than they were back in 2019. So I hope that sheds a little bit of light on things. Again, the good news is that the GIC has held steady on out-of-pocket costs. But one of the points that was made by the GIC staff in yesterday's report is the fact that over that period of time, health insurance premiums have continued to rise. And even though retirees and active employees only pay a portion of the overall premium, every time your insurance costs go up, you feel it. Our members are living on fixed incomes. So even if it's a slight increase, our members are going to feel it. You know this, we know this. Thankfully, the GIC has also acknowledged this. And as we have been reporting, there's only so much the GIC is able to do about the price of medical care. They can try to mitigate that and try to control it, but at the end of the day, the cost is the cost. What they have to decide is what is the fairest way to split up that cost, and they have erred on the side of applying that cost increase to insurance premiums rather than increasing out-of-pocket costs, which can be incredibly unfair and overburdening for those who have to utilize their health care. The last point I want to make just before we wrap this up for this week is that next Tuesday, the State Senate will begin its debate of the fiscal year 25 budget. Please look to next Friday's weekly report on the details of where the Senate stands, as well as other information that is soon to be breaking news, I would expect. But with that, thank you again for tuning in today. Thank you for being a member of our association. If you're not yet a member of Mass Retirees, please consider joining. We represent all retired public employees from across the Commonwealth, regardless of where you may have worked or what your profession was. We also have an associate member program for those of you who are active employees considering retiring and would like to utilize our newsletter, reports like this, and other information we send out to help you better prepare and plan for your retirement. But again, thank you so much for tuning in, and we'll be back to you again next Friday. Bye-bye, everybody.